Welcome everyone, this is Dr. Mike Bucknell with Maximize Living, and this workshop we're going to be tackling the issue of cancer. Obviously this is a major issue in today's society as we see cancer just continuing to rise in almost every category, and this is a fight that we've been dealing with for easily the past 50 years aggressively, and yet it doesn't seem that we're making any headway whatsoever as we see the numbers just continue to rise. And unfortunately, I don't think, I do think that it's at a point today where literally every single family has been affected by cancer. That, pretty much everybody knows somebody that has died or is dealing with and having to cope with cancer right now. So, there just really is not too many more relevant topics that we can cover in terms of health on such a wide scale of issues, because you've got to really have a different understanding of what cancer is if you're really going to, steer yourself in a different direction from what most people are doing today. So I want to start off with a spot that I picked up on Dr. Len Caldwell's blog. The media headlines proclaimed former White House Secretary Tony Snow died from colon cancer, although they knew he didn't have a colon anymore. He had actually had his colon removed surgically after they decided to do surgery to remove the cancer that he had in the colon. Apparently, the malignant cancer had returned from where and spread to the liver and elsewhere in his body. In actual fact, the colon surgery severely restricted his normal eliminative functions, thereby overburdening the liver and tissue fluids with toxic waste. The previous series of chemo treatments inflamed and irreversibly damaged a large number of cells in his body and also impaired his immune system. A perfect recipe for growing new cancers. Now unable to heal the causes of the original cancer, in addition to the newly created ones, Snow's body developed new cancers in the liver and other parts of the body. And of course, we know that, the end result was he died of apparent colon cancer metastasis. So, there's a couple of key components that I want you to pick out from the idea behind this, in that the overwhelming idea out there with cancer is that it's somehow a foreign invader in the body. It's somehow a parasitic infection or some other outside foreign object that is using you as a host, if you will, to grow itself, and is in no way, shape, or form a part of your body. And if that's the case, then it sounds logical in Tony Snow's position to, since he has colon cancer, let's go ahead and remove his colon. And, of course, if you remove the source of the cancer, then, you stop the spread of the disease. But unfortunately, it just pops up somewhere else because we have the wrong idea of cancer from the get-go. The problem with cancer right from the beginning is that it's not a foreign invader in the body. It's your cells of your body literally breaking down. Here's what it is in a nutshell. Okay, before we move on to a second scenario. What cancer really is your body is on a daily basis being genetically damaged and altered due to chemicals and toxicity and nutrition and the different components of your lifestyle. Your body is constantly in a state of flux where new cells are being produced as old cells are being destroyed. But the problem comes when the overburdened, the damaged cells are being created much, much faster than the severely impaired immune system and function of the body can restore those cells back to health by replacing them with new ones. So what you have is a recipe where those cells just continue to grow unchecked because there's nothing there to stop it. And then the next step with that is the body starts creating tumors to barrier off those cells and those masses from the rest of the body so that it can stop the progression of that disease. So, I want you to realize that tumors are literally a protective mechanism within the body itself. That is very important to understand, how all of this plays out. So The second testimonial is this one is unfortunately from a Maximize Living chiropractor. One of my personal coaches, not to say names, one of our coaches was adjusting patients and noticed himself progressively getting weaker over the course of weeks and months. And then one day he literally collapsed on top of a patient and has been battling brain tumors since, because they found out that he had brain cancer. So this is about his situation. $410,000. That was the cost of 2 weeks of my hospital stay and surgery. Obviously, from one point, thank God we have emergency crisis care, but in this case, even if they could have removed all the tumors for the money, I still would have been left with the cause. The reality was they jumped the gun, didn't look at the blood tests already done, and they didn't do more blood tests. Instead, they assumed they could go in and remove the tumors. Once they opened me up, they said, oops, and they realized they couldn't touch them. So they closed my skull back up, then decided to do all the blood work. The reason I'm explaining what happened is to teach you the value of what you do, talking to us chiropractors. They had no problem charging $410,000 just for a mistake. Now I'm doing alternative care. Here is what was already spent. Century Wellness Clinic, $22,000. Greek blood test, $3,000. IV vitamin C therapy, $175 each time, 2 times per week. IV H2O2 therapy, $200 each time, 1 time per week. UVB blood cleansing, $175 each time, 1 time per week. Poly MVA, $130 each bottle, 1 bottle per week. And then extra supplements, $300 a month. All of the alternative care is an out-of-pocket expense. Over a 6-month period of alternative care, blood work, and MRIs, it will cost around $60,000 cash. And the goal is that I am cancer-free and tumors are gone, which is happening. What about the cause? Why did this happen? Almost none of that money will go to fix the cause of the problem. All of the treatments, thank God, are getting rid of what is there already. From most of my testing, they said I was very toxic for years. Also, thank God I've been getting adjusted for 15 years, but I still don't have a great spine. My cervical curve is 30 degrees off, I have curvature in my lower back, and both of my iliac ligaments are damaged. I start to do traction and wobble, then stop. So when it came to my spine, as important as we know it is, we sometimes neglect it. I spent years putting everyone's health before mine. After seeing what it costs to treat the after effects of toxicity and subluxation, what would it have been worth to begin care 35 years ago? What if my mother would have learned the 5 essentials when I was little? Then she would have realized the dangers of vaccines, the importance of detox, the importance of nutrition and supplements, and the most important part, she would have learned about the dangers of subluxation. How do you think she feels right now knowing this? If you saw my MRIs of the brain, 2 of the tumors were covering and choking the brainstem so much that the neurosurgeons repeatedly said, I don't know what you've been doing, but we don't know how you made it this long. I do. Maximize Living and the 5 essentials kept me alive and will keep me alive for another 70 years. I did not start chiropractic care until I was 23, and I didn't start Maximize Living care until I was 33. I went 23 years of nerve damage, eating horribly, getting vaccinated, being toxic, and knowing nothing about taking care of myself. Our job is to make sure that the world knows that they can't live this way anymore. So you see that these 2 scenarios are radically different, and the point here is not to point out that one is alive and one is not, and somehow make a blanket statement that under the medical model you're going to have bad results, and alternative care you're going to have good. That's not the case at all. What I want to show you is a difference in mindset, is a difference in the approach is always based on the core understanding of what the problem is. And you can see that the foundational beliefs of the chiropractor versus one of the highest ranking officials in the United States of America, you can see how radically different their idea is. And unfortunately, if I went through the outcome of Tony Snow's life, what his last days looked like, you would see a radical difference in the quality of life in those last days as well. So I want to go through just start by going through some of the facts with cancer, just so that you get an idea of exactly what it is that we're looking at here. So, an investigation by the Department of Radiation Oncology, Northern Sydney Cancer Centre, Australia, into the contribution of chemotherapy to 5-year survival, showed startling results. The overall contribution of curative and adjuvant cytotoxic chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia and 2.1% in the United States. Okay, I want to make sure that you guys understood that from layman's terms. What that study shows is that the contribution of having chemotherapy to the survival rate of people just up to 5 years is a whopping 2.1% in the United States. Okay, yet what is the standard of care for cancer in America? It's chemotherapy. 2.1% effective at adding to contribution. And it's the standard of care. Do you see something severely wrong with that? Imagine if out of 100 patients that came into a chiropractor's office, into our office, only 2 of those 100 people actually got resolution of symptoms. Okay? Imagine how well our reputation would be in this town. I mean, it's mind-boggling when you think about that, the scale of that is the standard of care, yet it's 2.1% effective. Okay? Does that make you want to rush out and get chemotherapy the minute that you are diagnosed with cancer? Well, for a lot of people, it's fear that sells them into it. They're like, well, you know what? A 2.1% effective chance is that's better than what my doctors gave me. So yeah, let's just do it. It's basically just just throwing whatever we can, whatever we lose all hope. So we just kind of throw our bodies at the whim of the medical community. But this is a quote from one medical doctor, Dr. Alan Levin. Most cancer patients in this country die of chemotherapy. Chemotherapy does not eliminate breast, colon, or lung cancers. This fact has been documented for over a decade. Yet doctors still use chemotherapy for these tumors. Women with breast cancer are likely to die faster with chemo than without it. Yet, when you start talking about this with oncologists and medical doctors often refer to the FDA's definition of an effective drug because it achieves a 50% or more reduction in tumor size for 28 days. What they neglect to tell patients is that there is literally no correlation whatsoever between shrinking tumors for 28 days and actually curing the cancer and extending life. There's no correlation. What it boils down to when you start putting these pieces together is that what is the job of chemotherapy and radiation? Essentially blast apart the tumor. Just put a toxic grenade in the middle of it and blast it into shreds. But the problem when you do that is that all of that debris on top of the cancers is spread all throughout the body. So it's only a matter of time before the problem comes back with a vengeance. Hence, we call it metastasis, right? But the second, even more despicable fact behind that is that anytime that you see a cancer study being done, that they talk about survival rates as 5-year survival rates. And the reason why they cut it off at 5 years is because anything beyond 5 years shows absolutely pitiful results in the studies. Because generally speaking, people that go through conventional treatments don't last more than 5 years on a majority basis. So what you end up with is, they do a study and they say, well, the 5-year survival rate increased by, say, 20%. But if all of those people that survived then died at 5 years and 1 day, you understand that they would still be calling that a cure. Is that just, completely unbelievable or what? So even though you're dead, you're cured of the cancer. It's just absolutely absurd the way that they look at it. And, and it goes layers and layers and layers deeper. Even when you talk about cancer survival rates being improved, the reason why the cancer survival rates seem to be improved is because we're diagnosing the cancers earlier. So let's say that you are 57 when you were able to be diagnosed with cancer, and then you died at 60. But now we have better testing that we can actually diagnose you at at, I think I said 57. Okay, so just got lost train of thought there. 57 is when you got diagnosed, but you died from cancer at 60. Well, what if we could diagnose you at 53, right? Then the survival just automatically increased to 7 years instead of 3 years because we diagnosed it earlier, yet it has nothing to do with the cancer survival rate at all. So here's just a few more facts about cancer before we get into really what we need to do, like how we need to understand this stuff. Here's some facts. Number 1/3 of cancer is caused by diet. That's the World Health Organization. So the World Health Organization comes straight out and says that 1/3 of cancers are caused by diet alone. Okay? Statistics reveal untreated cancer patients live longer than treated patients. Think about that fact for just a minute. You know, most people when they go and they get diagnosed with cancer, they rush them into treatment saying that we need to do this now. We need to do this right now or else we're going to lose time. Yet the stats actually show that the people that don't get treatment at all live longer. So what does that really tell you is happening there is that basically they want to treat you before you can second guess yourself. So it just rush you through the process as quickly as possible. Third point, chemo and radiation are both known to cause cancer. I don't think we need to explain that to anybody. I mean, everybody knows that chemotherapy is a poisonous chemical. Radiation is, in the kind of doses, we're not talking X-ray radiation here. We're talking absolutely blasting the body with radiation. All right, conclusive evidence for the majority of cancers that chemotherapy has any positive influence on survival or quality of life simply does not exist. So we really don't have any positive, just conclusive, rock solid evidence that chemo really works in the first place anyways. And here's where we get to a recent survey of the Association of Oncologists. This recent survey showed that 91% of oncologists, the doctors that are actually doing cancer treatment, find no chemotherapy to be acceptable for them or their families. Okay, let me make sure that you heard me there again. 91% of cancer doctors will not do chemotherapy for them and their family members, yet they'll do it for their patients because if they don't, their family doesn't get to eat. That is a sad. I kind of put that on the same level. Anybody that would do that as a human being, I put that on the same level as being a prison guard at Auschwitz. You know, that it's, as long we'll go ahead and starve and kill and beat other people, so long as we get to feed our families ourselves. I can just pray that none of those 91% of doctors are here in Mobile. It's unbelievable. But of course, at 91%, you really gotta that makes you question the entire system altogether. The Journal of the American Medical Association says as much as 75% of the average oncologist's earnings come from selling chemotherapy drugs in his or her office. Okay, 75% of their profit comes from selling chemo drugs. And of course, the drug companies are making a fortune too. One of these drugs, the example, is tamoxifen. Okay, this is one I've had numerous patients be placed on, and this is a drug where they'll put the patients on for years after they have breast cancer, saying that they need to take this drug to keep them from getting from having their breast cancer return. Yet tamoxifen reduces the risk of breast cancer by a whopping 1.6% absolute value. Okay, the absolute benefit is 1.6%. How do they get away with it? Well, they fudge the numbers in a way. If you want to look this up and get into the details about how they do it, it's called relative benefit. So what they do is they basically estimate how many people should be helped, and then whatever, how many people are actually helped. That's, they kind of divide the numbers out. So, rather than 1 out of 100 actually showing a sign of improvement, if it's 1 out of 2 that they expected to show benefit from, well, they'll claim a 50% reduction in the risk of return breast cancer. Just blows your mind how they can fudge the numbers like that and get away with it this long. Okay, mammograms are known to cause cancer. Yet how many women get mammograms every single year? They get mammograms every year to so-called detect cancer, yet we know that the mammograms actually cause cancer. Not only do they cause cancer, but they have a 40% false positive rate. So, you're going in and you're getting checked and they find something that's there that's not even there. Okay, the American Cancer Society budget in 2008 was over $400,000, and 60% of that went to salaries, bonuses, and overhead. So the vast majority of it is going towards the business, running the business, not actually going towards research or anything like that like they say that they need the money for. In fact, less than 25% of the total budget actually went towards any kind of research. What is that research anyways? It's drug company research. They're giving the money to the drug companies to study which drugs are going to be more effective, right? But of course the question that comes to mind is, are they really even trying to find the cure? I mean, if you could really take one pill and just cure your cancer, what would happen to the entire industry? It would shut down in a matter of weeks. So, you've got to question motive here. The American Cancer Society's mission raises money to benefit the cancer industry and protect that industry from competition. That is the entire purpose of the American Cancer Society. There are 4 people employed for every one single patient that has cancer. So last time we were in Atlanta, we were strolling downtown by the Georgia Aquarium, and literally right across the street is the building for the American Cancer Society, covering an entire city block, some 4 stories high, just huge building there. And you look at something like that and you just have to call out motive. What is the true motive here? What is it that we're trying to do? Do we really want to find cancer? And if so, why do we see the most beneficial treatments that have ever come out constantly being banned and taken off the market? So let's move into the next section here. Now that you know some of the facts behind this stuff and you're starting to question how it all works, let's categorize some of the well-known problems that we see with cancer. And I'm going to go through these in terms of the 5 essentials of maximized living. Okay, so first of all, quality nutrients. We know for a fact that diet and nutrition play a critical role in as much as 84% of cancers, according to the research. We know that nutrients in crops are depleted due to modern farming techniques. We know that genetic engineering has made foods larger and longer lasting, but has sacrificed nutritional quality in actually doing so. We know that most fruits and vegetables are picked well before ripened so that they last the trip to the store. But unfortunately, 75% of the nutrients come into the fruit or vegetable in the last 48 hours of vine ripening, which means they're deficient in most of the nutrients that are supposed to be there. So you're getting what looks like a red pepper, but it's actually 25% of a red pepper. We know that there are dozens and dozens of foods with so-called anti-cancer properties, and they don't come in a box or other packaging. How many foods have we now shown actually have anti-cancer properties? How many different fruits and vegetables are there out there? We know that, and no, they're not just the Amazon berries or the Himalayan berries or any of these crazy juices that you have to get through a network marketing company to save you. It's not that difficult. These foods are everywhere. Every single fruit and vegetable has different components and chemicals that are beneficial to the body, but they've got to be there in the fruit or vegetable for them to help you. Okay, we know that vitamin D deficiencies have a very significant correlation with cancers of all kinds, that when you move further away from the equator and you see the average sun exposure decrease, that cancers start to increase. We see that since we've started using sunscreen on a massive level, that we see cancer continuing to increase, especially skin cancer. So what is it that we're really fighting? Is the sun really that bad for us? Step 2, toxicity. We know that environmental toxins are everywhere due to chemicals. We know vaccines and drugs are toxic. Every single time that you put a drug, over-the-counter or prescription, in your body, that is, as I told a patient this week, one more bullet you're putting into your liver. That's one more toxic chemical that you're putting into your system that is now creating cancer and that your body is having to repair. We know that many food additives and preservatives are carcinogenic, meaning that they cause cancer. We know that most people, when tested, are absolutely loaded with toxins. Third point, exercise. We know that most people do not get enough exercise. We know that most people are overweight due to lack of exercise. We know that excess weight dramatically increases your risk of cancer. We know for a fact that increased exercise builds the immune system. You put those points together and you see that exercise decreases weight, gets your immune system built up, therefore improves your body's ability to heal and function. Step 4, the nerve system. We know for a fact that the nerve system controls every single cell, tissue, and organ in the entire body. And the only way that those cells continue to function at 100% is when they are 100% under control and influence of the nerve system, which is basically the maestro of the orchestra within the body. We know that cancer is cells that have been genetically damaged or altered. We know that cancer is cells that don't properly communicate with others. We know that the immune system is the body's natural defense against cancer. We know that the heightened immune function means less cancer. We know that decreased immune function increases risk of cancer. We know that improving the function of the nerve system improves the function of the immune system, thereby reducing risk and improving recovery from cancer and other disease. Last one, mindset. Point 5. We know that Dr. Viktor Frankl, he wrote the book Man's Search for Meaning. This is a doctor that was in the prison camps during the Holocaust. He showed that those who lose hope don't make it very long. What he actually did is he searched and he decided that because this man was a psychologist in his profession, when he was brought to the camps and he had to watch his family be pulled away from him to never see them again, his wife and his children were taken away to be put in the furnace, and he was sent over for slave labor. And so what he did over the coming months is he watched all of the people and started studying what actually happened. And what he saw is the minute that those people lost hope, that they would stop eating, they would develop disease, and they would very, very quickly die of starvation or fatigue or anything else. But those people who hung on to hope, thinking that the next day, that their salvation was going to come, or on the other hand, those people that found purpose and meaning in actually being there. That was his actual purpose, is that he had the full intention of going back after the war and writing this book and telling the world how this actually happened and what happened on the inside of the camp. So those people that had a purpose and a meaning in being there actually did quite well. We know that belief determines actions. You don't do something if you don't believe in it. So we know that though miracles sometimes happen, hope alone usually isn't enough. That there is action that follows through with that. So what does all that put together mean? It means we know that you do what you truly believe. So if you don't do, then you really don't believe. There is no try. If you're trying something, that means that you really don't believe it, so you're just trying to find a way to rationalize and excuse yourself from responsibility. So that is a very important point, understanding the mindset that goes behind all this. Okay, so here's just a couple of things that I want you to really think about, and especially these are things that somebody that has cancer needs to be strongly considering. The best option is always prevention. That's the first thing. We can spend all night long talking about what to do with cancer once you have it and how to overcome cancer. But the reality from that second testimonial is that if we start early and we keep the body healthy from a young age and we keep the body fit, then you really have your best option, your best opportunity to never develop cancer in the first place. It's always easier to keep a handle on prevention and maintenance than it is to try and fix a badly disastrous problem once it happens. Okay, number 2 I want to paint this picture for you. If you were to meet a grizzly bear in the forest, okay, let's say that you're walking through the woods, and all of a sudden you turn a corner and there's a gigantic grizzly bear there standing on its two hind feet, ready to chew your head off. Okay, you happen to have a hand grenade in your hand. Now, here's one option. One option would be to go ahead and pull the clip on that hand grenade and drop it on the ground in between you and the grizzly bear. And of course, the hope there is that the grizzly bear will catch all the shrapnel and will die, but you will somehow come out of that and live on the other side. Now, does that sound like a very good proposition to you? You know, the purpose behind that visual there is to make you understand that that's exactly what is happening in conventional treatment. When we go in and we do chemotherapy and radiation, these therapies that just absolutely devastate the body so much that you lose every little bit of hair on your entire body. You know, what does that tell you when your hair is falling out and you're losing weight and you're vomiting and you have diarrhea and everything else? All of these massive detox processes, it just shows you what is actually happening to the body. And that's literally the same thing that's going on there. It's just dropping a hand grenade and hoping that you come out okay, but the cancer doesn't. In fact, a medical doctor, there's a quote where one of the medical doctors says that the miracle is not that people survive cancer, it's that they survive cancer and chemotherapy. That's the real miracle. Number 3, if you developed cancer while living in a particular way, then doesn't it make sense that if you continue to live in that particular way, it's very unlikely to change? You know, a lot of times when I talk to people that have developed cancer, we start talking about what to do, and it's like, well, you know, I'm thinking about this treatment and I'm thinking about that treatment, and I'm like, okay, well, shouldn't it be the first thing be you analyze what you've been doing and you do differently? Because whatever you've been doing has now made you sick and you've now developed cancer. So whatever you've been doing, you need to figure out what's wrong with that. And understand that you've got to literally look over the course of your entire life, right? Because that Maximize Living doctor, he was doing everything right for the last number of years. But unfortunately, he went 23 years of abusing his body before then. Myself, I'm in the same situation. 20 years before I ever got my first chiropractic adjustment. 20 plus years before I ever started learning anything about nutrition and detox and exercise and anything like that. I was probably 25 before I really started to exercise on a regular basis. If cancer was a parasite or alien symbiote, wouldn't we have identified it by now? You know, maybe we've been looking at the entire picture wrong. That comes to what I was talking about earlier, you know, that we do have the picture wrong. That is not some foreign invader in the body, but rather it's a breakdown process within the body as a whole. And until you figure out what's breaking your body down, and then secondly, how to rebuild it healthy and strong again, then you're not going to be walking the right lines. Okay, it took more than a century and another million plus sailors dead before the fact that scurvy was caused by vitamin C deficiency actually became widespread. I don't know if you guys know that, but well back, you know, back in the day, you know, when they did all of the travel on ships, well, they would send these sailors out to sea on these large vessels. And they'd be out for months at a time. And what would happen is the men would start developing scurvy and they would die. And I mean, they just lost millions of people to scurvy. Well, a physician of sorts discovered that vitamin C deficiency from not having any fruits or vegetables on the ships, that's what was causing the scurvy. And he tried to spread that information, but it took more than 100 years before that actually took hold and people started utilizing it on a regular basis. So 1 million plus more sailors dead before they actually spread that information. Okay, many of the best working cancer therapies have been banned from medical use, and I talked about that earlier, but But that is something really strong you should be thinking about, because if they're banning the things that are actually working, then again, you've got to call questionable intent. So what do I do? You put all this stuff together, and at this point you should be massively confused at like, okay, so my idea of cancer has been completely wrong, so what do I do? Well, the first thing that you want to do is pick up a copy of the movie Cancer Inside Out. Okay, we do have copies of this movie at the office. You can watch clips and trailers on YouTube, I'm sure. You can order it online from the website ravediet.com. But this is a wonderful movie, at least in the first half, at really showing you exactly what's going on in the cancer industry. It's just, full of literally hundreds of quotes on the cancer industry, and it puts it together very well so that you understand exactly what cancer is, and you can wrap your mind around what the problem is. Now, do I agree that the second half, that it's all about, diet, and that, all you have to do is avoid meat and you're going to cure your cancer? Not necessarily. That's why we're going to add to all that right here. But do definitely check that movie out. Purchase it. We have copies at the office for $10, if you guys are interested in picking up a copy of that. And anybody that you know that has cancer or has had cancer, make sure that they get to watch a movie. So until we know a therapy that works 100% of the time, how much should you do? That goes back to the mindset. If I have cancer and I want to spend additional years with my family and be able to treat patients for decades to come, well, then I'm going to do anything that I can to get well. That Maximized Living doctor, he's doing everything possible to be able to hold on to what he's got and and be able to make a recovery so that he can be with his family and his small children. So we would definitely appreciate you guys' prayers, for him and his family as he's going through recovery. Now, if you decide to just leave it up to chance, though, what do you suppose your chances are? If you just take things for granted and you say, well, I'm just gonna see what happens, or I'm just gonna go along, or I'm just gonna agree with what my doctors say. If any of these things sound familiar or common to you, then you really need to start questioning this, going back, listening to this again, watch that movie. Do as much research as you can to understand that you really need to start taking this stuff aggressively. Okay, so these are not just the ideas of what you can do necessarily just, if you were to develop cancer, but a lot of these things, as I'm going through them, you need to start altering these into your lifestyle so that you can start preventing cancer in the first place. So first point I'm going to go into is nutrition. If I develop cancer, pretty much what I would do is I would immediately switch to a raw vegan diet, meaning that I would be doing fruits and vegetables raw as much as possible, and I would be doing low, if no meat consumption whatsoever. If I do eat meat, even right now, we probably are about 95 to 98% grass-fed meat, meaning that we don't eat the traditional corn-fed meats that you get from most grocery stores and in most restaurants. So you want to limit your amount of meat no matter what, because you really just don't need a whole lot in the first place. But meat can be carcinogenic, even though I personally believe that the body is designed to eat meat anatomically. There are lots of there's lots of different components to the human anatomy that shows that it definitely has the ability to deal with meat. But the idea there is to go as raw as possible. Okay, that also means no artificial anything. I would also monitor my dairy intake. I would really make sure that I was only consuming raw dairy products, if anything, from grass-fed, graze-fed, grazing cattle that are not getting vaccinations and not taking antibiotics and all that kind of stuff. I most certainly would not be eating ice cream and yogurt and cheese from the store, just whatever I pick up on the shelves. I would also do no sugar, because sugar absolutely is proven all over the research to feed cancer. So the more sugar that you consume, the more that you're literally just feeding straight into the cancer. It kind of reminds you of Little Shop of Horrors, if you guys remember that movie. Intravenous vitamin C injections. This is one of the more medical alternatives. There are some doctors across Nevada and internationally who will do these therapies, but intravenous vitamin C injections at high doses seems to really make a big difference. Also, intravenous H2O2 therapy seems to make a big difference. Poly-MVA is a new product that is showing a lot of promise. They've got some really great results initially. It is a little bit more expensive. It's about $130 a bottle, which sometimes can only last you a week. But it is promising as far as what it's able to do in specifically attacking the cancer cells and causing essentially apoptosis, where those cells just are destroyed. There's a great movie called World Without Cancer that explains the vitamin B17, or what they call Laetrile. It's a component that's found in apricot kernels and some other foods, but it's most concentrated in apricot kernels. There seems to be some research showing that Laetrile has a strong tendency to be able to dramatically affect cancer, because it essentially acts as cyanide to cancer cells, while it doesn't do any apparent damage to the regular healthy cells whatsoever. Harold Hoxsey, he was a doctor way back, probably in the 1940s, 50s, 60s, in that era. I don't know exactly, but you can pull up some movies, look up Hoxsey, Hoxsey, on YouTube, and you can learn more about him and watch the movies there. He used herbs like bloodroot and yellow dock and some of these other herbs that are now in a formula that we use from John Barron called Blood Support, which just cleanses and detoxifies the body, primarily the blood, so that the immune system is dramatically improved and able to destroy unhealthy cells. The core nutrition includes whole food supplements like paleo greens or any other just basic greens and vegetables product. Vitamin D3, most adults should be taking anywhere from 5 to 10,000 IUs per day just on a maintenance level. But if you are suffering with any kind of chronic illness, you can, according to Dr. Mayer Eisenstein, a medical doctor, take as much as 1,000 IUs per pound of body weight per day to improve the function of the body and improve the immune system. There seems to be some good new research coming out with vitamin D and its effect and correlation with cancer. So that's a definite for maintenance for everybody. And then the last one is perfect ratio omegas, because of course the cell membrane of the cells is the communication line between cells, and the omega fatty acids is what makes up those cell membranes. So if your cell membranes remain healthy, then your cells can intercommunicate properly, which of course we had talked about as being one of the problems with cancer cells. So those three things, the Paleo Greens, the Vitamin D3 Pro, and the Perfect Ratio Omega, those are the three core nutrition products that pretty much everybody should be taking on even a maintenance level and in higher doses if they are suffering with cancer or other disease. The second category is toxicity. Some of the things that seem to help there, calcium EDTA often is used to chelate heavy metals. Unfortunately, you would have to get that through a medical doctor. There's another product called what's the name of that stuff? Well, we'll have to get back to that. I can't think of the name of it right off the top of my head. But there is another product that was used for autistic kids to pull mercury from the cells, pull mercury from the systems and the tissues, and it increases the glutathione levels. And that seems to, it's called OSR number 1. Unfortunately, it was working so well with Parkinson's patients at dramatically improving their symptoms that the FDA decided to make it a drug. So that too you cannot get from a chiropractor or a health food store. You have to go through a medical doctor to get it. It's called OSR number 1. Daily Detox is the product from Maximize Living that is used to increase glutathione levels by giving your body all of the different components that it needs in order to produce glutathione. Glutathione is the most potent antioxidant in the entire body, so of course it has great effects with anything having to do with cellular destruction and regeneration. And it also has the BioClear component of it, which is the activated charcoal, to grab onto those toxins and pull them out of your system. As you know, you're not talking just a basic colon cleanse program, but rather a product that pulls the toxins from a cellular level and then binds them in the colon to pull them out of the body. Probably the easiest functionality overall in regards to toxicity, though, is to just simply eliminate all known sources of toxins in your immediate environment and diet. So get rid of your household cleaners, your personal care items, the air fresheners and stuff like that, perfumes, hair gel, shower gel, body wash, all this kind of stuff that has these toxic chemicals in them. Get rid of that stuff. You can go to a website called the Environmental Working Group. It's if you go to Google and you Google search EWG Skin Deep, you can find a great resource on how to look for the different components of products and see how safe they are for putting on your body. And then also, in terms of toxicity, another one that works pretty well that is a medical technology is ultraviolet B therapy, where they remove a small portion of of blood from your system, run it through ultraviolet light to destroy any pathogens that are in your blood, and then they re-inject that blood back into you, and it allows your body to start creating antibodies to those dead particles within your system. For some reason, it seems to work really well. Okay, the next component is exercise. Cancer cells simply cannot survive in oxygenated environments. So if you increase oxygen efficiency in the body through cardio exercise, then of course you're increasing the amount of oxygen in the tissues, which makes it very, very difficult for cancer and tumors to grow and proliferate and definitely metastasize, right? Okay, if you use high intensity, low duration exercise like surge training, it increases lean muscle mass and allows you to burn off excess fat and sugar stores with greater efficiency. So, of course, that improves on a lot of different factors too. Even it improves your factors such as hormones like human growth hormone, which has good correlations in the research with cancer properties too. Exercise known, of course, to decrease depression as well, which is, no doubt a common problem with people that have the diagnosis of terminal cancer. So anything that you can do to improve your mindset is going to help as well. Okay, the next point is the nerve system. Plain and simple, nothing heals without life flowing through it. If you have a dead body on the ground, it obviously is devoid of life. It's not going to heal in any way, shape, or form. You cannot put Neosporin on a cut on a dead body and see it heal. It simply can't, because all health, healing, and function comes from above down, inside out through the spine and nerve system. Dr. Henry Windsor, a medical doctor at the University of Pennsylvania, looked at all the cadavers, 100+ cadavers in his studies, and what he looked at is he found every single disease organ in the body, whether it was cancer or heart disease or kidney disease or anything else, and then he followed those organs, the nerve pathways back to the spine, and found that 100% of the time there was damage to the spine causing compression on those nerve roots and pathways. So Dr. Windsor was pretty conclusive in his evidence that the nerve system is the most powerful factor behind breakdown and disease within the body. Dr. Ronald Pirro, more recently, he found basically the same thing in a cancer immune study. What he found is that people that were under chiropractic care for maintenance purposes had a 200% improved immune system function of just the average non-chiropractic patient. But even more impressive is when he looked at cancer patients, he found that they had 400% the immune system function of cancer patients. So, of course, his understanding is, well, then that's pretty simple. Every single cancer patient should be getting chiropractic adjustments. Then the Journal of Vertebral Subluxation Research showed a study where they looked at serum thiol levels within the bodies of maintenance chiropractic patients. Serum thiol is an indicator for DNA repair in the body, which of course we know is correlated with cancer. And they found that the longer patients were under chiropractic care, the higher the serum thiol levels seemed to increase. And, lastly, on that note, people under chiropractic are shown just plain and simple to be healthier in numerous other categories. I mean, in aspects of fitness, in mobility, in life, how they perceive their life to be in terms of health and function. They seem to be happier. I mean, they're just, in pretty much every category you look in, out of a number of different studies, chiropractic patients just do better. Okay, and the last one goes into the mindset, which kind of just sums up all of it. It's that you've got to have the understanding that I can and I will, because the moment you give up is the moment that you're done. As Viktor Frankl very clearly showed, that the moment you lose that purpose in your life, it's over. And unfortunately, we've known that too well in personal experience. That the mindset is just so powerful in understanding, that you can, as long as you have that breath in your body, you can. But you've got to follow through. You've got to do the processes. You've got to fight with every single ounce of breath that you have in your body until that last breath passes through your lips and through your nostrils. You fight and you do not let go. You see, that power that made the body truly does heal the body. That power that God put in your spine and nerve system, it is the most incredible power, the most incredible force that you can imagine. Just to think that from the day that you were born, that it kept your cells alive, it kept your cells healthy, it brought one cell into 2 cells, into 4 cells, into 8 cells, into 16, and just continue to replicate until there were billions of organized cells all throughout the body. And those organs needed no help from you when you were born. That even though you had no education whatsoever, that those cells knew exactly what to do. Those organs knew exactly what to do. Your body worked like one grand symphony all together to know exactly what to do to keep you alive and keep you functioning. It's just an unbelievably mind-boggling how powerful the body is when you really give it credit where credit is due. You see, though, that power has to have transmission lines to flow, though. That power can't just bounce out through one part of your body and somehow magically land on another part of the body. That power flows down physical lines throughout the body. Those physical lines are the spine, the spinal cord, and the nerves that pass out from every vertebral level all the way down through the body. So as long as that power can flow down your brainstem, down your spinal cord, out through the nerve roots, then down those peripheral nerves until they branch off and reach every single individual cell throughout your entire body, then that power cannot reach its source. It cannot reach its destination from the source, and therefore that power and that function cannot create health within those cells. So always remember that the power flows above, down, inside, out, and it does not work outside in as the medical system would have you believe. The chiropractor, plain and simple, moves the bone. That's all we do. We remove the interference. God does the healing. It's that power inside the body that does the healing. We have nothing to do with it. So when you're thinking about the adjustment and you dare to give me or your chiropractor credit for healing you, think again. That is, that I just when patients say that, it almost breaks my heart that they would even think that I have anything to do with it, because ultimately all I do is move the bone. But it's the power inside of you that does all the healing, and that's what's important. So guys, it's this mindset and this understanding of how things work that is going to change lives and save lives. But I hope you see that it can't start when you get diagnosed with cancer. It can't start when it's already too late and you're 10, 20, 30, 40 years behind the ball. It's got to start now. It's got to start with prevention. It's got to start by letting your friends and your family know what they need to do to prevent it. Don't wait until they get cancer to try and help them. Do something about it now. You have the opportunity now to save their life. And that opportunity may be too late by the time you decide to open your mouth. So, guys, send your friends, send your family to my website at drbucknell.com to get more information about Maximize Living and what we do. Bring them to a community dinner. We do those community dinners twice a month. Those are for your friends and family so that they know what they need to do for prevention. I know it's easy to think about, the people that have low back pain and the people that have headaches and that they're easy to talk to. But talk to the people, too, who think that they're okay. Because the reality is they're not okay until they know what's going on, and until they're doing every component possible to prevent disease, then they're not doing enough. So get them to those dinners. Get booked up for the next dinner. Don't wait. Don't put it off. Don't put it off for another day. If your family isn't under care yet, oh my goodness. Your family needs the care, and you know that. You can't listen to this and not know that. So what are you waiting for? Are you waiting for finances? Are you waiting for time to open up? Well, if you're waiting for finances or time, what happens if they develop cancer? How are you going to afford that? How are you going to take the time off work that it's going to take to be able to take care of them? You got to think about these things before they happen. If you have any other questions about any of the other topics, get to my audio website at drbucknell.info. That's drbucknell.info. You have every single workshop that I've done to this point. They're all available there on the immune system and on exercise and shopping and all these different components, diabetes, heart disease. They're all on there on what to do so that you don't have to follow the same path as the rest of the world. Down that drug and surgery path, just chopping out organs and praying that these drugs somehow are your salvation. The last thing I want to urge you to do is get on my new blog at healthin60seconds.com. That's healthin60seconds.com. Register for it on there. There's a link on there that lets you put in your email address. And all I do is every day, or at least I try to every day, just pop in a short note on something that comes across my mind, a short little blip that takes you literally less than 60 seconds to read. But those 60 seconds over the course of a year is 365 minutes. Over the course of 3 years is almost 1,000 minutes. Over the course of 30 years, think about that. That's 10,000 minutes. I mean, that's a lifetime of education just by getting little 60-second blips here and there. So there's little things that you can do every day that you don't need to be a healthcare professional. You don't have to treat and diagnose and deal with patients every single day, figuring out their healthcare problems to become a master of health and healing. You don't need to do all that. You just need to know where to get the right information. So, guys, I'm here for you. Maximize Living is here for you. We have a mission that's bigger than any one of us single doctors. We've got a nation to turn around. We've got a healthcare system to transform. And I hope you see that I simply cannot do it without you. So I urge you to be on the mission. Get after your friends. Get after your families. And see what you can do to continue to urge and push them forward to a better life of health and healing. So I thank you for everything. This is definitely one of those workshops that is not a one-shot go, so you may want to go back and listen to it and take notes the second time. So God bless you. Get on those websites, drbucknell.com, drbucknell.info, healthin60seconds.com, and pick up the movie Cancer Inside Out from The Office. God bless you. Have an awesome adventure in your health and healing.